When searching for a mesothelioma doctor, it is crucial that you find a physician who is highly experienced in treating this rare and aggressive cancer. Mesothelioma is a very complex disease that takes many years of experience to fully understand and properly treat. Here are the key steps you should take to thoroughly evaluate a potential mesothelioma specialist's credentials and experience level. Start by asking for referrals from trusted sources like your primary care doctor or local cancer hospitals. Experienced mesothelioma doctors will often be affiliated with major cancer centers where they can collaborate with others on the latest research and treatment protocols. You can also search online directories from top organizations like the American Society of Clinical Oncology to find board-certified medical oncologists in your area. Confirm the doctor's specialty and board certification status. The ideal mesothelioma specialist will be a medical oncologist who is board certified in medical oncology by the American Board of Internal Medicine. This signifies they have met specific education, training, and examination requirements in this subspecialty. Board certification is a good indicator they have extensive experience and knowledge treating many types of cancer, including mesothelioma. Inquire about their specific mesothelioma experience level. Ask directly how many mesothelioma cases they have treated over their career. Look for a doctor who has treated dozens, or preferably hundreds, of mesothelioma patients. Experience is crucial for this cancer since no two cases are exactly alike and doctors need comprehensive experience to handle the various complex presentations and issues that may arise. Find out where they received their medical training and earlier work history. Mesothelioma physicians typically have trained at major academic medical centers or NCI-designated comprehensive cancer centers where they gained additional expertise through clinical trials, advanced training programs, and mentoring under leaders in the field. Their earlier work history should include experience on a lung cancer or mesothelioma treatment team. Ask if they participate in mesothelioma clinical trials. Because mesothelioma research progresses rapidly, the best doctors actively enroll eligible patients into trials studying novel therapies, diagnostics, or multimodality treatments. This allows access to cutting-edge, investigational options not yet approved. It also keeps the physician at the forefront of the latest standards of care. Inquire about their mesothelioma research involvement and publications. In addition to clinical care, look for a doctor who regularly publishes research studies, presentations, and papers advancing the understanding and treatment of this disease. They likely collaborate with other experts and regularly attend major scientific conferences to stay up to date. Published research demonstrates specialized expertise that can translate to superior care. Determine if they belong to relevant professional organizations. Reputable doctors frequently hold memberships in top groups like the Asbestos Disease Awareness Organization, British Thoracic Society Pleural Disease Guidelines Group, and European Respiratory Society. These groups establish treatment guidelines and educate members on the latest standards through conferences and educational events. Ask for referrals from their past mesothelioma patients. If appropriate and if given consent, a doctor should be willing and able to provide references from former patients who can speak to their compassion, communication skills, consideration of treatment preferences, and professionalism. This feedback can help validate their experience and quality of care. Evaluate their familiarity with multimodality treatments. The most experienced mesothelioma doctors utilize an integrated approach including surgery, chemotherapy, radiation, and other supportive care options depending on the stage and characteristics of the cancer. This coordination requires extensive experience and knowledge of how different modalities may complement or sequence with each other. Pay attention to non-medical credentials and experience as well. Top physicians should showcase excellent interpersonal and communication skills to develop trust with patients and families. They need proficiency explaining complex topics, engagement in shared decision-making, and consideration of individual needs, goals, and circumstances outside traditional medical factors. Other experience like leadership roles demonstrates well-rounded qualifications. No single factor can guarantee an optimal outcome for such a difficult cancer. but thoroughly vetting a doctor's credentials, education, training history, research and publications, institutional affiliations, professional memberships, treatment experience level, approach to care, and non-medical qualifications can give you reasonable confidence you've found one of the most qualified specialists available. Taking the time for due diligence in selecting a mesothelioma doctor is critical for exploring all options and receiving the highest quality care and support available. Thoroughly evaluating key indicators of a doctor's mesothelioma: education, experience level, approach to care, research background, institutional affiliations, professional memberships, input from former patients and non-medical credentials can provide reliable insights into their specialized qualifications for effectively diagnosing and treating such a rare and complex cancer. The high-stakes nature of mesothelioma demands diligent vetting of potential physicians to locate one with ideally dozens or hundreds of prior cases to optimally manage each unique patient.